Your physician has prescribed ActiveCare in order to prevent DVT, deep vein thrombosis, in your upcoming total hip or knee replacement surgery. Today, awareness of drug side effects and complications is growing among more and more people and American healthcare professionals. Your physician's natural choice was obvious: ActiveCare. ActiveCare allows your physician to offer DVT prevention treatment without bleeding complications. DVT is a blood clot that forms in the leg and can move to the lungs, causing a life-threatening condition known as pulmonary embolism, or PE. ActiveCare is designed to prevent DVT and its deadly consequences. It works by using SFT, synchronized flow technology, an advanced system that applies gentle intermittent compression to the legs, increasing the speed of blood flow in the veins and reducing the risk of clot formation. ActiveCare is also intended for use in diminishing postoperative pain and swelling, reducing wound healing time, reducing edema. ActiveCare is a small, portable, and comfortable device. It effectively prevents DVT without bleeding complications.
Fit so nicely around my leg, there weren't any gaps. It didn't shuffle up and down. If I got up, it got up with me. I didn't realize that it was sitting on my leg at all. I liked ActiveCare because it was really easy. I mean, I didn't even notice that it was on. I could wear my pants and nobody could hear it, nobody could see it, nobody had any reason to think that I was any different than anybody else, which was nice to feel just kind of like everybody else at the time. But I especially liked it because I didn't want to take any blood thinners. I didn't want to have to be further dependent on medication at the time, and it allowed me a little bit more freedom and a little bit more control of my own care.
You should already be familiar with ActiveCare since you've been wearing it in the hospital. Before you're discharged, you'll receive an ActiveCare rental unit, either the same unit you wore in the hospital or one just like it. You'll take it home with you and use it for the duration of your therapy as prescribed by your doctor. Once your therapy is complete, the device and all components except for the sleeves must be returned at the end of your treatment. Your rental system will include a set of sleeves, 2 tubes, and 1 charger. The device and all its components, except for the sleeves, must be returned at the end of your treatment. To use ActiveCare at home, follow these 4 simple steps. Step 1. Placing the sleeves. Place the sleeve with tubing at the knee. Fasten the top flap first, smoothing the sleeve down the back of the leg, fastening the middle flap, and finally the bottom flap above the ankle. Close the sleeve with the fasteners until it fits snugly. Proper fitting should allow the insertion of 2 fingers between the leg and sleeve. Check this 2-finger fit at the opening near the knee and the opening at the ankle. Repeat the same procedure on your other leg. The sleeves can be worn over a simple cotton stockinette, thin pajama bottoms, or tube socks. They may also be worn under sweatpants or pajama bottoms to hide the tubing. Step 2. Connecting the sleeves to the device. Connect one end of the extension tube to the sleeve connector. Look for the arrows on each component and connect them arrow to arrow. Make sure you have a secure connection at both ends. Repeat this step for the other sleeve. Connecting the device. Connect the AC-DC adapter to the DC power supply jack on the back of the device. Do not use a cell phone, camera, or any other type of charger. Use only the adapter that came with your system. To charge the battery, connect the adapter to the power mains. An on-screen indication appears showing that the battery is charging. When the battery is fully charged, the indicator will stop flashing. Step 4. Operating the device. Turn on the power switch located at the back of the device. Your device will automatically select the correct mode of operation. Then the sleeves will begin inflating sequentially, starting at the bottom. You should then see the main screen with 4 options: compliance bar, treatment mode, battery, and status menu. Let's go over what each one of these means. The compliance bar will show you how long you've been wearing the device. You should be wearing it almost all the time, even when sleeping. Your surgeon can determine if you've worn the device for the amount of time required. If the compliance level shown on the screen drops below 80%, you should call your doctor. The treatment mode is selected automatically, so you don't have to do anything. The numbers you see represent the average pressure applied to your leg. The battery icon indicates your battery charge level and will let you know when to recharge. While the battery is charging, the indicator will be active. It will stop flashing when the battery is fully charged. A fully charged battery should last 5 hours. If you're active and on the go, you'll need to recharge the battery during the day. Anytime you're stationary, sitting in a chair or lying down, leave the device connected to the main supply so the battery can charge. ActiveCare on the go. With a fully charged battery, ActiveCare can be disconnected from the main supply for up to 5 hours, so it can go wherever you go. It's lightweight, portable, and comfortable to wear for maximum protection against DVT. Wear it as much as possible, at least 20 hours a day.
To me, wearing the device was so much easier because all I had to do was put the stocking on and wrap the device, and I carried it with me everywhere. It had a nice little shoulder, so it was like wearing a purse. It wasn't inconvenient at all. And even when the grandkids are here and stuff, they would come and look at the motor and look at the picture, and then they were off doing their thing. So it just became part of your normal routine. So it was not an inconvenience at all. And it was great. I did not have to take any pills. I did not have to take any shots. I did not have to have any blood work done. I just had to wear the device.
You can wear ActiveCare almost everywhere and anytime, but never in water. It should be removed for bathing, swimming, or when you're out in the rain. To take the device with you, place the carrying strap diagonally across your shoulder to prevent slipping or discomfort. The device should always be connected to the leg sleeves. Be sure to wrap up the tubing as shown. If you need to take a break for bathing or skincare, simply turn off the device and remove the sleeve. Never leave the unit running when you take it off. To resume use, place the sleeve on your leg as instructed earlier, and then turn on the device. Caring for your ActiveCare. ActiveCare is easy to care for. All components were cleaned before you received it, so there's no need for additional cleaning. The disposable sleeves are for your personal use only. They should never be machine washed. If you need to clean them, just wipe them with a damp cloth. If you must clean any other part of ActiveCare, use a cotton swab or pad moistened with a 70% alcohol-based solution. Do not wet the pump or let it come into contact with water. The device should be stored at room temperature between 60 and 90 degrees. Do not cover it with pillows or blankets or take it into a wet or steaming environment such as a bathroom. Troubleshooting. ActiveCare can detect any problems that might arise and will prompt you to take corrective action. The most common problems are low battery, air blockage, and air leakage. If you see the low battery screen, it means you need to charge your battery. This usually occurs after 5 hours of unplugged use. Air blockage is usually caused by a kink in the tubing. You can usually fix this by checking the tubing and smoothing out any kinks or blockages you may see. An air leakage may occur when the tubing isn't properly connected. If you receive this message, make sure all your connections are secure. The majority of other problems can be solved by turning the device off for a minute or two, and then turning it back on. If problems persist, contact your outpatient provider. You're ready to get active with ActiveCare. You've got all the information you need to get started with ActiveCare. You're ready to get active with ActiveCare at home. Let's review some do's and don'ts about ActiveCare. Don't let any components get near water. Don't wear the device when bathing. Don't use any other power adapter but the one that came with the device. Don't take breaks in ActiveCare treatment for longer than 30 minutes. Do wear the device as much as possible, at least 20 hours per day. Do enjoy all your normal activities as allowed by your doctor. Do keep the device plugged in while you're stationary. Do return the device when therapy is complete. Is ActiveCare covered by your insurance? The use of ActiveCare allows your physician to offer DVT prevention treatment with no bleeding complications. Your insurance or health plan may cover the cost of ActiveCare. You should consult with your health plan provider to learn more about any out-of-pocket costs you may be responsible for regarding this therapy. It is possible that you may receive an EOB, explanation of benefits, from your health plan provider, outlining your coverage status. Keep in mind that this is not a bill, only an explanation of benefits. Medical Compression Systems Incorporated, MCS, will work with you and explain any out-of-pocket requirements. Contact your health insurance company and consult with MCS for further information regarding any out-of-pocket expense. MCS reimbursement can be reached at 314-426-7778. If you have additional questions or need more information about ActiveCare, contact your outpatient provider or consult the user's manual. You can also call the ActiveCare hotline at activecare.mcsmed.com. For any medical questions, please consult your doctor.